Can you describe for me your condition before your surgery? What were you like? What was it like, your spine and your physical condition?
Well, I was bent to the left a whole lot more than I am now. I'm still bent, not nearly as bad.
Wooford Young is 67 years old and lived with a degenerative spinal condition called kyphoscoliosis, which caused his back to slump forward and curve severely to the left. Dr. Hazem El-Tahawy, a neurosurgeon who specializes in complex spine cases at the DMC's Harper University Hospital, explains.
Kyphoscoliosis is a deformity that occurs in the aging spine. The exact cause is not fully understood, but it starts with the progressive degeneration of the disc spaces and laxity of the ligaments and the joints in the back. The next thing that happens is that the natural curve of the lower lumbar spine starts to flatten out. When this occurs, the balance and the center of gravity of the body starts falling forward.
The long-term result can be significant disability and inability to function. That's what happened with Mr. Young. X-rays taken of his spine show just how pronounced the condition had become. And then he saw one of our DMC Medical Library videos and learned about Dr. El-Tahawy.
I liked what you said about him. I liked how he talked. I had nothing to lose by going and seeing him. And he said all the things I wanted to hear.
Dr. El-Tahawy uses a new surgical technique called extreme lateral interbody fusion, or XLIF. This technique allows a minimally invasive approach to the spine, much preferred when possible to the traditional approach, which involves much longer incisions, muscle dissection, and a longer recovery.
The difference is huge. I mean, it's from the back you would have an incision like that, and this one is something like this, an incision like that. So it is a huge difference.
XLIF takes advantage of a natural empty space in the body to access the spine. The patient is positioned on his side. Two small incisions allow the surgeon to use his instruments to separate muscle and expose the spine. He then removes damaged discs and replaces them with an implant called a cage. The cage restores the proper space between the vertebrae and allows bone to grow over the space, fusing the vertebrae. The incisions are closed with a few stitches.
The recovery is very remarkable compared to the other approach. I mean, typical hospital stay is maybe 2 to 3 days. People are back to natural activities very fast. A couple of weeks, within that time frame.
And with the other
recovery,
with the traditional approach, how long?
Still next months.
I asked him if what he had done would be sufficient. He said it won't take care of the whole problem, but it will take care of most of it, and it shouldn't get any worse.
How's your progress? How do you feel? Tell me the difference in your condition now.
I can walk further now. I don't wake up at night from pain. I can do a whole lot of things that I couldn't do before.
What would you say to anyone out there who may suffer from kyphoscoliosis and have the same sort of condition that you did, about what relief is available to them at the Detroit Medical Center? What would your
I would
advice to
say
them be?
offhand, I would give them Dr. El-Tahawy's phone number. Tell them go do it. As a matter of fact, I've already told a few people.
Have you?
He's good.
And
He is good. There's no ifs, ands, or buts. He's good.
Having excellent physicians like Dr. Hazem El-Tahawy who listen to their patients and use the latest techniques to help them live fuller lives is a reason why the DMC has become a major center for referrals and second opinions. If you would like to find out more about complex spinal surgery techniques, make sure to watch the other videos in this series. And for more information, or if you would like to make an appointment with Dr. El-Tahawy, visit us here at dmc.org. The DMC, We just think it's a better way to get better. I'm Enrique.